We are excited for this conversation. Dr. Wittstein is an orthopedic surgeon at Duke University, and she is also our scientific advisory board member. And a big thing that we want to do at Scene is really educate everyone about things pertaining to bone health, to osteoporosis, calcium. And so this is kind of kicking off our education webinar series that we hope to do every month. And each month we're going to be talking about something related to osteoporosis. And each month, of course, we're going to be talking about it in relation to what's out there in terms of the evidence and real human clinical studies. So today we are going to be talking about all of the myths and misconceptions surrounding calcium because you probably know there's a lot. There's a lot floating around on social media, like, for example, calcium supplements are bad. Calcium supplements are useless. Calcium supplements cause heart attacks. Uh, your bones need just more than just calcium. All of these things we've probably heard, and it can get a little bit confusing. And so we want to break it down each one by one and also talk about the evidence pertaining to each of these myths. So this is kind of like a facts or fiction series. And so the first one that we want to go over, and this is a big one, is are calcium supplements bad? We're going to bring the nuance to this question because there's a lot of nuance to be had, especially if you have osteoporosis. So that's the first myth. Calcium supplements are bad. And to get us started, I just want to bring you in, Dr. Wittstein. What do you give us the background? Where is this coming from? Why do people hear about like, oh, calcium supplements are bad. I shouldn't be taking them.
Yeah, so I think a lot of that comes from concerns for places where we think of calcium as being bad, like in our coronary arteries, or some of the data on, elevations in calcium may be being related to MIs or heart attacks, and so I think that's the main concern that people have. Um, and unfortunately, not everyone gets enough calcium through their diet, and it is very important that we have adequate calcium as well. When you have a chronic insufficiency of something over time, that's ultimately going to add up and have some, other negative effects.
Mhm.
But I think the negativity comes from the deposition of something in a place where we don't want it, like in the coronary arteries,
Yeah.
versus where we need it, in our bones. And of course, calcium has many other functions in our body, like regulating processes, like even the beating of your heart or the contraction of muscles and things like that.
Mhm.
So it is necessary as well.
Yeah, I think that really highlights the importance that we need to distinguish. Are we talking about dietary calcium or are we talking about synthetic calcium? Because both can be calcium supplements, but there's a big difference between the two. And so let's talk about that a little bit, right? We know that in terms of calcium, it's best to be consumed through our food, our everyday diet, through your dairy, through your sardines, through your greens or nuts. That's the best and ideal form to be consuming your calcium. But as Dr. Wittstein just mentioned, it's hard to eat all of your calcium, your 1,000 milligrams or 1,200 milligrams from food exclusively. So that's where calcium supplements, synthetic supplements came about. But the main differences between the two is that calcium that's present in food or dietary calcium is present in a different form than synthetic calcium supplements. Synthetic calcium supplements are bound to a salt. So, calcium carbonate, calcium citrate, calcium lactate, all of these calciums are bound to a salt and they fall under the umbrella of synthetic calcium supplements. But dietary calcium, depending on the food source, is usually provided in terms of free calcium, calcium that's not bound to a salt. And so that main difference has a lot of implications on how well we absorb that calcium and then how well we utilize that calcium in our bones. And then the second important piece there is that calcium in food is part of this food matrix. It's called like dairy food matrix because calcium is present in high amounts in dairy or just food matrix in general. And so that means that there's other nutrients that are present in that food that help that absorption and utilization. What are your thoughts, Dr. Wittstein?
Certainly there are cofactors that are needed, for absorption of calcium. Like, of course, vitamin D is a big one, but like also magnesium, which is,
Hmm.
necessary for the activation of vitamin D and helps with calcium absorption. The synergy of food or the matrix, as you said, is important. But then there are also studies and data showing that the synthetic supplements can have a longer elevation in terms of circulating levels of calcium, and even some data to show that that supplements that are synthetic in nature may also then in those time frames that the circulating calcium is elevated may also be associated with some elevations in blood pressure.
Hmm.
Um, and so that's different than when you're ingesting food and something is absorbed sort of more regularly and doesn't have like such a prolonged elevation. It doesn't have like that same effect. So, um, what do we make of some of these changes? Like, is it really detrimental to have like a transient elevation of your blood pressure? Maybe not, or maybe it is if you already have high blood pressure and a lot of inflammation in your vessels and things like that. I don't know, but that has been demonstrated to be an effect. So.
Yeah. And that study will link in the recording because we want you to have the resources. But there's this really nice graph in that study that depicts very well what happens when someone takes a bolus dose of calcium carbonate and what happens to their serum calcium, which means the calcium in their blood, versus what happens when someone eats calcium in their food and then what happens to their blood calcium over time. And what you see is that after you have calcium carbonate, you see a spike in your blood calcium and it's sustained for several hours after you took that dose. Whereas if you ate that calcium from food, and they used dairy in the study, then you see that spike in blood calcium and then it goes down almost immediately after, which means that the body is processing or metabolizing that calcium appropriately. So there's a clear distinction in how the body uses that calcium and then metabolizes it out so that you have like built-in safety mechanisms with dietary calcium versus synthetic. I think that's kind of the main point that we wanted to get across with this first myth is, are calcium supplements bad? Well, no, but you should know the differences between synthetic supplements and dietary calcium supplements. Like our calcium chew, it's just made from food. It has those same properties as milk because it's derived from milk. Um, but
And do
that's
you and do you need a supplement? I mean, there are people who get adequate dietary calcium, and exceeding the amount of calcium you need isn't necessary. You can't like force your bones to be stronger by getting an excessive amount of calcium, but you don't, you'd rather not be at a deficit because your body will mobilize the calcium either by reabsorbing more through your kidneys or breaking down bone to get what you need. But there's also some safe upper thresholds that have been established as well. Like most people would not be able to exceed them. Like even if you loved dairy, you probably wouldn't exceed, 2,500 milligrams a day, for
yeah.
example. Mhm.
So then what are the recommended amounts of calcium per day?
For people age, 18, above over the age of 18, 1,000 milligrams a day. But if you're a woman over the age of 50, you're going to want 1,200 milligrams per day. If you're a man over 70, you're going to bump up that level to 1,200 milligrams per day.
Mhm.
Teenagers generally need about 1,300 milligrams per day. So a little bit more. And then interestingly, for people who are pregnant, there isn't an increased amount that is needed because the body does naturally increase the absorption rates of calcium. So, if you're a woman in your 30s and you're pregnant, you also need 1,000 milligrams per day. And there is also not an increased recommended intake for women who are lactating, just because the mechanisms that the body uses to get the extra calcium for lactation is actually through this complex hormonal process with a low estrogen state and something called PTH, like peptide. But it is working through a hormonal mechanism that you cannot combat with extra calcium. So interestingly, like that's just a subset, but the recommendations don't change for lactation or pregnancy. But sorry, that's a sidebar.
Yeah.
Yeah.
Yeah, no, that's an important note and a note that is very personal, obviously, since I broke my
Yeah.
back
Yeah.
postpartum and
Yeah.
I probably was never eating enough calcium from
Right. So that
food
would be an example
at
of you
that
still
point.
want to get the 1,000 milligrams, but your condition is extremely rare, as we know.
Yeah,
So,
yeah.
yeah.
So then it's interesting, and let's just highlight, call this out, right? Like the recommended daily amounts for calcium until your age 50 is 1,000 milligrams, and then it bumps when you're 50 and older. Why is that bump?
Actually, that's a good question. You may know the answer to that more so than I, but I've always like stuck with that as the RDA. I mean, over the age of 50, women do have a tendency for declining bone mineral density. So the there are things you can do to increase the formation of bone and reduce the breakdown of bone.
Hmm.
There are multiple systems in our body that trigger different hormones to maintain our calcium levels. And like, for example, the parathyroid hormone, will respond to a low calcium level by activating and then mobilizing from bone. So, women who are in a low estrogen state in the postmenopausal time frame are going to be more likely already to be breaking down bone. So I don't know if there's a change in absorption. Do you know the answer to that? I've always just quoted that because that's what's recommended. Is that like why is it 1,200 over 50 all of a sudden for women? I assume it's because of the
It's
changes in bone metabolism, but yeah.
Yeah, exactly. I think mainly it's because of the decrease in estrogen, which is bone. It halts the breakdown of bone. We know that estrogen is bone protective, and when you go through menopause and you have a decreased or no amount of estrogen anymore, so you need that increased amount of minerals to support bone density. But then also, as we age, you know that your absorption in your gut changes. So as you age, your absorption becomes less efficient. And so in order to overcome that barrier of less efficiency, then you need to eat more throughout your day so that you could absorb as much as you were absorbing before. So I think it's a whole host of those things.
Yeah, and there are changes in the gut with menopause as well. Obviously, there is this risk of declining bone density that happens at that time. And so it's just
Yeah.
interesting though, because in the lactating state, we can't combat that, with extra calcium, but
Hmm.
perhaps that's more effective in the postmenopausal state. So yeah.
Yeah, that's I guess a positive thing, right?
Yeah.
Okay, so I know, so let's wrap up this first myth, which is, are calcium supplements bad? The answer is not yes, and the answer is not no. It depends on you individually, and what we want to do is provide you with the information so that you can make a decision about how you want to reach and can reach your daily recommended amounts of calcium. If you can eat all of it from food, that's the most ideal. If you need to supplement by eating a calcium chew or taking a synthetic calcium supplement, then that's a method that you can use to reach your daily amounts and then choose between the ones that are out there, making that informed decision. And I know questions are coming in through the chat, and we'll look through those at the end.
One thing we didn't talk about is like there are some people who get a lot of GI upset with calcium supplementation and then they don't like tolerate that. And so that can be something else to consider.
Yeah.
And then of course, like the fact that you would need to spread this out over the course of a day, you really shouldn't take more than 500 at one time because you're not going to absorb more than that. And so like those are some of
Hmm.
the GI tolerance can be one of the issues with synthetic supplements.
Yeah, yeah, the risks or the prevalence of the risks of getting bloating, constipation, nausea are pretty high with synthetic calcium supplements, which is why people are always looking for better solutions. Okay, should we move on to myth number two? Okay, this is a big one. Calcium supplements are useless. I've seen this, and I think it's related to certain headlines that make it out on social media or in the news. And for example, a headline that I read recently says, calcium and vitamin D supplements offer little to no meaningful benefit on fracture and fall prevention. And so if you just read this headline, and if I just read this headline without any context of where this came from or if it applies to me, I would take it at face value and then assume calcium supplements are useless and throw my calcium. But it's our job, right, to analyze where this came from, look at the article that this is specifically sourced from, and talk about that. So that headline came from a recent meta-analysis that was published in the Bone Mineral Journal. And it's important for us to dissect it because the results do not apply to women with osteoporosis or osteopenia or who have had a previous fall and fracture, all of these things. And so we want to talk about the study. Do you want to give us a bit of a background there, Dr. Wittstein, about this article?
Yeah, I read this article in detail because I'm like, wow, that's quite the headline. And you know, the thing is, if you have people who are achieving adequate dietary intake, right, they're not going to benefit from a supplement. Or you may have people who perhaps who knows what their dietary intake is, but maybe they're not even compliant with the supplement.
Hmm.
Or then you have people who have very little risk, a premenopausal woman who's very active, whatever, with no prior history of an eating disorder or something. And then you may have someone who's high risk, like a postmenopausal woman with osteopenia or osteoporosis. These are like very different scenarios to look at. And then additionally, there's, question of prior use of a supplement, or is this a new supplement? Is the supplement actually supplementing and meeting a need, or is it supplementing above and beyond a need that is already met?
Hmm.
And that's where I don't think any logical person would say you should be having an insufficient intake of calcium. And in at-risk populations, that's even more important. I think it's been very clear for a long time, people who are very high risk, like people who live in nursing homes, things like that. It's been shown, for sure that supplementing with calcium and vitamin D helps reduce fracture risk. Like the Women's Health Initiative had a good study looking at, randomized controlled trial where women who were not previous users of supplements who were then given calcium and vitamin D supplementation did have a reduced risk of fractures. So I think it all depends on the specific population you're looking at. And that the paper that we're talking about in BMJ is generalized to the general population, not specifically looking at risk populations. And so I think like every person needs to think about like where they are in the population. Are you someone who does or doesn't have adequate dietary intake? And are you part of an at-risk population, which would then make those results not really applicable to you?
Hmm.
Um, as a broad overview, I would say. But
Yeah.
there are many people who do not need a supplement because they have very little risk and they have adequate dietary calcium. And that would
Hmm.
make sense that they don't need a supplement. Yeah.
Right. Yeah. If you're getting your 1,000 or 1,200 milligrams of calcium, of course there wouldn't be a need to take more, right? Um,
Yeah. And what
but
is the supplement? Is it synthetic or is it food-based or whatever? That would make a
yes.
difference as well.
Yeah. And I guess to be super clear, what is defined as a high-risk population in which the results of this BMJ study would not apply to you?
So someone with osteopenia or osteoporosis, someone who's in a nursing home,
Hmm. I think they
yeah,
had,
anyone that's has other I think additional risk factors for osteoporosis, the same things that we would consider risks for that. But
yeah. Yeah, so if you have osteoporosis, osteopenia, if you're over the age of 80, you require residential nursing care, you have a baseline vitamin D deficiency of less than 25, all of that is defined as high risk. And the authors call out in the conclusion that if you fall within these high risk populations, then this study results may not be applicable to you. And that's the really, really important piece there, because the purpose of their study was, well, I want to look at population health and population level data and see what we can find. They weren't zooming in on people with osteoporosis and seeing if calcium supplements or vitamin D supplements are helpful in reducing risk of fracture. They were looking at it at a population health level data. So that distinction is super important. And then when we look at that study, um, yeah, the analysis says it's not designed to apply to the general population. There was a different study that you were talking about, Dr. Wittstein, where the Women's Health Initiative, which was the one of the biggest studies, I think, in women, and over a really long period of time, it was released, and then a few years later, they took a subset of that population to look at something specific. And so in 2013, the author did a specific study in women, like you mentioned, who weren't taking calcium supplements at baseline and who were not obviously meeting their daily recommended amounts of calcium. And they looked over time, did they have a benefit in terms of fracture? And they did. They found that if these women were adherent to their calcium 80% of the time, there was a statistically significant benefit in reducing the risk of hip fracture. And that was 35 to 38% less likely to break a hip over the study period. Again, so this is in women who weren't taking calcium supplements at baseline, who then started and then were adherent to their calcium
And
for
specifically in
80%.
postmenopausal women. Yeah, I think you said that.
Yeah,
Yeah.
postmenopausal woman. So I think we wanted to provide this context because I think if you will continue to see headlines out there that may be a little confusing or jarring, and if we take it for face value, then it could be harmful. So we want to give a little bit of a background about this study and then what study we should look at specifically if we have low bone density. Anything to add there, Dr. Wittstein?
No, I think that was a good summary.
Okay.
Um, I think it's also just, I kind of think about things very simply. Like if you aren't getting adequate calcium, I mean, this is a very simple thought process, is that that's when you might consider a supplement. And that just seems like common sense, you know.
hmm
So,
Yeah, and if you're not eating enough and you start eating enough, then your
mm,
risk of fracture goes down.
mm.
So, yeah, really simply put, I think that's a great way to put it.
Yeah, like
Um,
nutritional deficiencies are bad.
yeah,
And and meeting them is a good thing. So,
I think there's a lot of noise out there. It's like, and then it can get really overwhelming to listen to what's out
mm,
there. And so this is a good rule of thumb, like always try and simplify,
mm.
stick to the things that are foundational. And there will be people who talk about these like fringe nutrients or fringe studies, but what we are talking about is the foundation and the nutrients that have the most benefit for osteoporosis.
And I think like also you will sometimes hear, for instance, about vitamin D. Like
Yeah.
there are some potential other health benefits to consuming a higher level of vitamin D, like not exceeding, for example, if you don't have a vitamin D deficiency, you probably shouldn't exceed more than 4,000 international units per day. But there is some data to suggest that, higher than what is, the recommended daily value, be it 600, 800, whatever your age is. But um, for example, there's some data that taking 2,000 international units per day may help reduce joint pain.
hmm
Or, some data about associations of vitamin D supplementation with potentially, dementia prevention, things like that. I can't think of any scenario anywhere where exceeding, like striving to exceed your calcium requirement there's not like any, unlike vitamin D where there may be some other benefits to maybe being a little higher than the daily value, but not exceeding 4,000 international units per day if you don't have deficiency. There's not like that. There isn't that corollary to calcium. Like it's not going to harm you if you're kind of exceeding and staying below 2,500 milligrams per day, but you don't have to strive to exceed
Yeah.
the daily value.
That's a really good point that you bring out because there's there's a couple more distinctions between calcium and vitamin D. that we were just talking about, right? Like vitamin D, you can take a little bit more because of maybe some other potential benefits. You don't see that with calcium. But then also, when we look at blood levels of vitamin D and blood levels of calcium, you can't interpret them in the same way either. Can you speak to that a little bit?
Calcium is going to fluctuate a lot more. I mean, with your like dietary ingestion, I think more
Hmm.
so, but yeah. Uh, so yeah, I'm not sure exactly where you're going with that question if you want to.
Yeah. What I was alluding to is that with vitamin D, when you're checking your vitamin D blood levels, it can dictate whether or not you should be consuming more vitamin D in terms of supplements versus not, right? Like if your vitamin D comes back at less than 25, then you know maybe I should be taking a little bit more of my supplemental vitamin D or going outside and getting more sun to increase it to the target levels. So you can look at blood vitamin D levels in that way and interpret it, and it'll dictate how much you can eat or how much you should increase your supplements. But when we check your blood calcium levels, that does not indicate how much calcium you're eating. It indicates how well your body is regulating calcium um, in your body. So when we eat calcium, right, your
That's
body,
what I was implying about. Yeah, it's like there are different fluctuations in
yeah.
calcium than there with vitamin D. Yeah, exactly.
Right. Yeah, and so even if your blood calcium comes back normal, that's a good thing, but that's not actually indicating that you're hitting your 1,000 milligrams or 1,200 milligrams of calcium a day. It's telling us how much calcium's in your blood, which is very tightly regulated, but it's not an indication of how much calcium is in your bones. So in order to know how much calcium you should be consuming, you do kind of have to add up generally, okay, how much calcium am I eating from my diet? Am I drinking a glass of milk? Well, that's 300 milligrams of calcium. Am I eating some Jarlsberg cheese? Am I having some broccoli? And you have to eyeball it with your diet, and that'll give you a baseline of how much calcium you're eating, and that will allow you to determine if you need a supplement or not.
Right, because your body is always going to strive to maintain whatever calcium it needs for all the different reactions, again, like necessary things like the beating of your heart to happen. So yeah,
Yeah, I like the analogy that you said last time, Dr. Wittstein, about your bones being like
like
a bank account.
the bank. Yeah. Yeah.
Yeah, you need to deposit into your bank account because later on in life you'll have to pull out of it.
Yeah. Yeah.
Oh,
Where
okay.
it's actively happening. Yeah. Yeah.
Yeah. So that segues nicely into this one where, we see headlines where it says your bones need more than just calcium. And this is one of the myths that I think are true. Your bones do need more than just calcium. Our bones are not just calcium, it's a whole host of other minerals, including phosphorus. Magnesium helps with that process. Protein, collagen. So, a lot of things are in bone. And so I want to take a second and just call out some of the key nutrients that are necessary for bone health outside of calcium, since we just talked about how important it is. What are some of the other ones that you like to focus on?
Yeah, so of course everyone thinks of calcium and vitamin D, but we were talking earlier, magnesium is one of the cofactors that activates vitamin D. It also is a regulator of parathyroid hormone. It's also one of the minerals, in your lattice structure of your bone. So magnesium is one. So you think if you need magnesium and vitamin D to absorb your calcium, and then there's vitamin K2 which is a vitamin that will help with activation of something called osteocalcin, which is sort of like think of that as directing calcium towards bone to help with the mineralization of bone. So we need that. You're right, we need adequate protein, which ultimately collagen is made up of peptides that comes from protein. And you need vitamin C because that helps with cross-linking of collagen, which is important for structure as well. And that's just to name a few, but that gets back to the benefits of getting things through food and when possible. There are some things that it can be hard to get through food, like it can be hard to get food, adequate vitamin D through food, depending on what you're eating. One of the ones I think is really hard to get is the K2.
Yeah.
It's in certain things. Like we've talked about how I cannot tolerate natto, which is this food that is extremely high in K2, but there are some things I love. Like I love Jarlsberg cheese, and that has a good amount of K2 in it. But fermented foods have some, but like it's such a distinct list of foods. So I do think like K2 is one that might be a little bit hard for people to get from their diet.
Yeah.
So that's why I think about supplements. Maybe, sometimes when there's something that just you're not gonna consistently get through your diet. Dietary fiber, that's a big one.
Hmm.
That is that's not a micronutrient. It's not like a vitamin or mineral, but it's kind of a macronutrient. But
Yeah.
dietary fibers is really important for bone health because that is basically the fuel for the bacteria in your gut, and your gut microbiome then generates something called short chain fatty acids, which have a direct impact on the processes that regulate bone breakdown and bone formation, and do suppress the pathway towards bone breakdown. So dietary fiber is actually one of the things we want to get from food as well for our bone health. But I mean, there are
Yeah.
more, but those are the ones that I usually like think about highlighting.
Yeah, I think about the same ones too. And I think those have the most evidence directly related to osteoporosis in peer-reviewed human trials. And so that's
Hmm.
important. We will always want to look at the evidence because as some people may know, studies can be done in rat or animal models, and then eventually they progress after many years to humans. But humans is where we can have the most applicability to us, obviously. Okay, so that bones need more than just calcium. Yes, that's true. Bones need calcium, protein, fiber, vitamin D, magnesium, vitamin C, vitamin K2, all of these things. We call it the matrix of food because all of those things play into how well we can absorb that calcium and then utilize it into our bones. So I know there's a lot of questions coming in, and I do want to make sure we get to a few of them. This first one, Dr. Wittstein, I think you're going to like because it's about Jarlsberg cheese.
I do love your cheese. What's the question?
Yeah, it says,
Is there
is
any
there
other
any
cheese?
other cheese that has similar benefit?
Yes. So interestingly, it kind of depends on how the cheese is made. So, like, there's some camembert cheese that is made with um uh a bacteria that ferments in a way that produces, and some that doesn't. So one of the cheeses that consistently has it is Jarlsberg cheese, because of the specific enzyme that is used in something. If it's labeled Jarlsberg cheese, they use that enzyme. But other cheeses are like manufactured differently in different places, and it's like hard to know.
Hmm.
But like as a general concept, these like sort of semi hard cheeses, are potentially a source of these like longer chain forms of vitamin K, like the MK9, and so MK7, 9, those they have like a longer half-life. There are other
Hmm.
forms of K2, like there's MK4, which is more in things like chicken and stuff, but that's a very short half-life. So the thought is that you want these longer chain forms of vitamin K2, like the MK7 and 9. But so I know, so I think the nice thing about the Jarlsberg cheese is it's more consistently going to have that because of the like actual process through which it's made.
And it tastes good.
And
It
it
is
tastes good.
my 5-year-old
Yeah,
daughter's favorite Jarlsberg
I know.
cheese.
Like I actually read a study where, so there are some camembert cheeses that have it, but then like in one of the studies that I looked at that looked specifically about the amount of K2 and how that affected your K2 levels, they specifically used a type of camembert cheese that did not have
Mm,
any of it in it. So that's where it's kind of like frustrating, but
yeah, that's
it
also
is so good. Yeah.
yeah, that one's good. Natto is if you
And
don't
it has a lot
know,
of calcium in it too, besides the
yeah.
vitamin K. Yeah.
Natto is a fermented soybean that has high amounts, probably the highest amount. It's a food source with the highest amount of vitamin K2, and it's eaten in Japan. But it does have a very distinct taste. It is
Some would call it
fermented.
pungent.
Pungent is a word I've heard used to describe it. I tried it for the first time a few months ago when I was visiting Japan. It was interesting. It's very stringy and people usually eat it with rice and soy sauce, but it's a great source of vitamin K2.
Hmm.
We have vitamin K2 obviously in our new chews, and ours is fermented from fermented chickpeas. And so again, the fermentation process is the important piece when it comes to vitamin K2. And we have the MK7 form, which is that longer chain form, longer half-life, so you can dose it once a day versus like 3 times a day, as you would need for the MK4 form. Okay, someone says they're allergic to dairy. Should I take more than 1,200 milligrams?
Well, so the whole concept of a daily value, and Jenny, you correct me if I misspeak because
Hmm.
you have this pharmaceutical background, but comes from the idea that it is expected that all these foods have different amounts of bioavailability, and you're not going to actually do all the calculations of everything you eat. But I always tell people, ideally, like one of the good things about eating different sources of things and varying your diet and maybe not eating the exact same thing every day is that you're going to hopefully change that up some. Now, there are certain foods that people think of as being a really good source of calcium that you would have to just eat like so much of to actually get much calcium. Or there are some forms that are just not highly bioavailable just because of the like phytates or whatever and the food like spinach is an example I always give. It has a really low bioavailability, like very low.
Yeah.
So even though there's some calcium in spinach and there are other great micronutrients in it, it's just like that you if you got all of your calcium from spinach, you would have to eat like an insane amount of spinach because the bioavailability of it is low. Versus if you're like, let's say you're avoiding all forms of dairy, but you're then okay, you're going to want to choose the ones that have, try to lean towards the ones that have higher bioavailability just so you don't have to eat so much of these other foods
Hmm.
to achieve it. So like cruciferous vegetables would be a good example, or basil seeds, or chia seeds. Bok choy has a very high bioavailability. Um, so there are certainly kale is another one, arugula. Those are forms of green. So broccoli, cauliflower, kale, arugula, bok choy. These would be greens that have like higher bioavailability. You might just want to like lean towards those so that you could be getting more out of the foods you're eating that are your non-dairy sources
Yeah.
of calcium. Um, but then it can be hard if because dairy is such an easy source of calcium, it can be hard to get enough if you aren't eating dairy. And then that can sometimes be where a supplement can help. And then I don't know, Jenny, if you can
Hmm.
explain about like, do people, I don't totally understand, but how people who have, if they have like a lactose allergy or whatever, and in the chews, how there are some milk products, but there's not
Yeah.
lactose in it, correct? Or
Yeah, it's a good point. So dairy, I'm lactose intolerant, and so I think that's one of the reasons why I struggled to eat enough calcium growing
Mhm.
up. And so when I was diagnosed with osteoporosis and navigating supplements and thinking about how can we eat calcium from food in an easier way, even if you have lactose intolerance, our chews, it's made with just the minerals that are present in milk, so none of the fat, none of the lactose. And so if you are lactose intolerant, you can consume our chews, which is kind of like a loophole that we created so that you could get calcium from milk without the stomach side effects of drinking milk conventionally.
And there are, of course, like lactose-free milks, and then
Hmm.
and Jarlsberg is naturally lactose-free. So
Dr.
even
Wittstein is not sponsored by Jarlsberg cheese.
I'm not. I just what's so funny is my son and I, like when we go buy Jarlsberg, we have like an arms race because he starts eating it and then I start eating it. And I've noticed that our local Wegmans, they've started stocking bigger and bigger blocks
Yeah,
because we go and we buy like 2 blocks, and then so we've noticed that the blocks they're putting out are getting bigger. I think we're personally
you're contributing to that. Yeah, we just go to
yeah.
BJ's and get the huge thing, and we're like,
Yeah.
okay, that'll last us for a week.
Yeah.
But yeah, I
Mm.
think there's a main thing with people who are maybe vegan or vegetarian or allergic to dairy is that Unfortunately, you do have to be more conscious about where you
Hmm.
get your calcium and how much, and it does have to be more varied because of those factors that you just mentioned, Dr. Wittstein, of bioavailability and other nutrients that are present in that food. And I think we answered the next question, which is, should you try to spread out the calcium throughout the day, or is it okay to get the needed amount in 1 or 2 meals? So the optimal rate of absorption of calcium is at 500 milligrams. That's where you have peak absorption. Think of it as like it's the most efficient dose. So that's why we recommend eat your calcium in 500 milligram doses throughout the day. You could have less than that and split it out throughout the day. For example, if you have a little bit with breakfast and then a snack and then lunch and then a midday snack and dinner, that's also good. Um, so it's best to kind of spread it out throughout the day instead of concentrating it at 1 time or 2 times a day.
Yeah. And I mean, any supplement bottle you read, if you're like, let's say you're taking synthetic supplement, they're always going to say like take twice a day. It's not going to be more than 500 milligrams because you couldn't use that much all at once
Mhm.
anyway.
Although
Um,
some companies, will have 650 milligram doses.
oh,
And that's a good call out because that is just a marketing scheme. They want you to think that you're getting more calcium
yeah.
with this higher dose, but it's not actually providing you more benefit.
Yeah, that is true.
Mhm.
Uh, I know, and sometimes like I really love the taste of your chews, but sometimes I have to think about when I'm going to have it because if I had a bunch of dairy at breakfast, I don't want to like waste it. So then I might eat it later in the day,
Yeah.
just in case I actually needed it. But yeah, so sometimes I think about that. I'm like, oh, I don't want to take this right now because I just not that it wouldn't harm me, but
hmm
I feel like I'm missing the purpose of it if I were to eat it with
With a
when I
calcium heavy meal.
when I'm already yeah. Yeah.
Yeah. Some of our customers say that they eat it like after dinner because then by that point they know how much calcium they've eaten
Mm.
throughout the
And it's
day.
like a dessert, yeah.
And then it's like a dessert. So it's like a little treat and it
Mm.
replaces the dessert.
Mm.
Also, there's some data that shows that well, we know this, that your gut motility slows down in the evening and while you're sleeping. And so that can help you maybe absorb more calcium. So that could
Mm.
be beneficial as well. Okay. I know we're coming up on time and there are some more questions here. We will record them and try to answer it in our newsletter, which we will send out in a couple of weeks. Our newsletter, if you're not subscribed, please subscribe on our website. You just submit your email and you'll get all of this information, including the recording and the answers to some of these questions. And then again, next month we'll be back and maybe with a guest talking about another topic. If you have topic suggestions or if you have a question and you want us to talk about something specifically, please email us and let us know. Anything else, Dr. Wittstein?
Oh, I was just quickly reading through. Someone asked about eating like 3 or 4 chews a day. That would be like 2,000 milligrams a day. You don't need to eat that many chews in a day.
Yeah, that would be
Yeah.
a lot.
Yeah.
Um, because
And presuming you're getting none from your diet either. Yeah.
which is also rare. Like it's hard to eat all of it from your food, but
Hmm.
it's also rare that you don't eat any. So
Right. That would be unusual. Yeah. Hmm.
there's a resource from the International Osteoporosis Foundation. They have a calcium calculator. So you could just Google search that, and that's what I use in order to calculate roughly how much calcium I'm eating every day. And we will link that as well. Okay, thank you so much for joining, everyone. I hope that was helpful. We wanted to talk about the myths and misconceptions about calcium and give you the research behind it. We'll link all of it, and we will see you next time.
Bye.